Hi, so this is dietitian Khushbu Tilwani. I'm talking with Dr. Sonia ma'am, Dr. Sonia Chandani. She's also from Surat and she's a gynecologist. I'm a clinical dietitian. Today we are going to talk about a very important topic, that's vitamin D, which is like 90% of Indians are mostly deficient into vitamin D. Whenever we test, they don't even have a normal value of around 30. They are almost into 5, 7, 3, 10. That is the range. So, ma'am, how important is vitamin D and what do you feel about it?
I mean, in clinical practice, we often see out of 10, 6 people who have symptoms related to vitamin D deficiency, let it be an ovarian cyst, or infertility, or muscle weakness, or fatigue, or general system lethargy, and they're not even aware that it is relating to vitamin D deficiency. So they come to us with symptoms, but then we diagnose, okay, kidney and liver are also involved, and they have not been aware that this is deficient. So it's very often underdiagnosed or undiagnosed. And there are people who are getting routine annual health checkups and just for blood test, and then they are taking supplements on their own, but still it is not giving them results the way it should, because it is not the complete metabolic scenario which they're looking after. So I think vitamin D needs more attention from the clinicians and patients' perspective. So I'm happy you chose this topic. So could you tell us how do we make our lifestyle and food a little bit different so that we become better?
Sure, ma'am. There are many things that we can do. So, first of all, if talking about lifestyle, that is the most important thing that we should add into, that's the sunlight, because vitamin D can easily be converted to vitamin D3. The absorption is there and it is directly converted to D3 in your skin. So, that is only after the exposure with the sun. So, that should be in the morning time, 7:30 to 10:30 is the ideal time wherein we should follow this, and at least 30 minutes of the sunlight is recommended for everyone, that we can include in our lifestyle in the morning if that is possible. If that is not possible, if you are into some region or some areas where sunlight is not easily available, so in that case what we can do is we can eat the fortified foods that is available. Nowadays, the government is fortifying the foods with the oils with vitamin D, the cereals with vitamin D, and milk also has vitamin D. So that can be added. Or maybe if you are a non vegetarian, then it is very good for you because sardines, fish, egg yolk, everything is very rich in vitamin D. So that also can be taken. Or otherwise, if you can sun dry the shiitake mushrooms or the white mushrooms, the button mushrooms, if you can dry them into the sun and then use it, then it is also fortified with the vitamin D naturally. And other thing that we can add into is the green glass bottle or the blue glass bottle that we can add, that is written in Ayurveda in Charak Samhita book, and mostly that also helps in increasing your vitamin D levels very slowly, but it does. So that is also very helpful, ma'am, in the diet perspective and in the lifestyle perspective.
Yeah, wonderful. And actually, being a fat soluble vitamin, it's important, not to diet without dietitian's advice, because if you're not taking sufficient fat, the absorption of the vitamin itself also may be affected. So, whenever you're
Yeah,
taking a supplement like A, D, E, K vitamin, take an adequate amount of fat, especially if possible, take it with dairy products so that it is absorbed well
yeah,
in the form of food or tablets or sachet, whatever you're taking. So
yeah,
wonderful information indeed, yeah. And it
yeah.
will prevent lot many diseases, improve the immunity, and a lot of good results seen in chemotherapy patients, autoimmune disorders also, and longevity of life along with less frailty. So you
Yeah.
live quality. You live quality
Yeah.
then. Yeah.
And especially, ma'am, if they are taking the supplementation, so if at all they don't do the dairy, they don't do the vegan, I mean, they are vegan and they don't do the dairy. So, what they can also do is that they can eat after the breakfast or the lunch, because the breakfast or lunch might be having some kind of good fat into their daily routine meal. So that also can be taken post meals, so that it is very easily absorbed because it's a fat soluble vitamin. And also the second thing that's most important is it's 600 IU that is recommended by the RDA, by ICMR, that even it's male or female, you have to take around 600 IU on a daily basis. So if that is not possible through the food, then you can go for the supplementation as well. The supplementation can be 1000 to 2000 IU, depending upon the severity that it is. Or if it is a very low vitamin D, then you can also recommend 40 the booster dosage of 60,000 IU. Those are ideally recommended. So, yes, ma'am. Anything else that you wanted to tell regarding the
I
vitamin
think
D?
for kids also it's very important because outdoor activities must be planned in sunlight. Weekly trend must be there for the whole family to stretch in sun, and it's a healthy habit. So from nature you can take directly. And of course, the annual
Yes.
health screening is mandatory for all, and kids must be encouraged to have dairy. So it's good.
Yeah. Yes, ma'am. There's one person who's asking some doubt. They have one doubt, but they would message right now. Till then, ma'am, can you please help us understand more about vitamin D? Its importance and
See, it
symptoms, like generally the females have the symptoms
uh,
like hair fall.
in midlife onwards, there are lot many changes happening in the skin, the eyesight, the nails, the spine, general joints, agility of muscles, overall the strength of various systems, and the immunity, even the period cycles with ovarian function, fertility. So all these small things are actually deeply connected with the vitamin D levels. And once we have corrected these, we have found miraculous results for male infertility, for recurrent ovarian cysts, for various joint and bone disorders, for non-healing infections, non-healing wounds, recurring or resistant tuberculosis, better response with the chemotherapy patient. So this is all, like, I have seen personally happening beautifully. Like a very bad ulcer on the skin was not healing for very long, and then when we supplemented vitamin D after checking the levels, we got it cured in a week's time, which they were struggling for weeks. So for skin, hair, nails, fertility, I think I would say all the systems, even your hormone system is very deeply connected. So, like, if you have an abnormal thyroid function happening, please do check, because thyroid, parathyroid, and calcium metabolism are interlinked, and calcium absorption is boosted with vitamin D. So, it's like a whole complete system. So we must
Yeah.
understand it, and the liver and the kidney are responsible for each one reaction happening in the metabolism of vitamin D. So the system has to be in the harmony. Yes.
Yes. Yes, ma'am. Very true. So those who are suffering with too much of acne, or maybe feeling very fatigued, or having a very high hair fall, then you can do go and test for vitamin D. It would be deficit. So please start supplementing, not without doctor's advice, not by yourself. Please go and check it, and also ask the doctor for any recommendations. Ma'am, if you can suggest any one or two vitamin D supplements that they can see and say if they are deficit.
The test you want, or the
No, the
medicine you want?
supplements, medicine.
The medicine? Okay. See, it's available with all the over the counter chemist shops. You can definitely take, but just see that it is cholecalciferol molecule. It may be in a gel capsule form, it may be in a sachet form, it may be in a small liquid shot form. But the amount has to be seen, the expiry date has to be seen. Usually, we are giving 60K, that is 6 million, and then just get it checked with your doctor. Sometimes you're already taking so many medicines which have small amounts of vitamin D, and then you're adding more. So, at least annually get it checked with your doctor as well. But then I will not
Sure,
name
ma'am.
any company, but 60K polycalciferol is good enough.
3000.
So There's somebody wanting
Okay.
to connect, but we are not able to understand what exactly is the doubt. So maybe they can connect to us later.
They
Thank
can,
you.
yeah, they can comment. Yeah. Thank you so much, ma'am.
Bye. Bye.
Bye.